Hi everyone, welcome to the class of Pediatrics, 𝗲𝗵𝗵𝗵𝗺, and I am your pediatric faculty. My name is Dr. 𝗵𝗵𝗺𝗺. So the topic of discussion for today is Alagille syndrome. Now Alagille syndrome is something which is very much evident with the triangular facies. I'm so sorry because the video, the picture quality is not too good. This is the Alagille syndrome. Alagille syndrome is having a triangular face. Posterior embryotoxon, okay, some eye manifestations is going to be there, posterior embryotoxon, and of course the butterfly-shaped vertebra. Okay, the butterfly-shaped vertebra is going to be there. Although the picture quality is not very good, but then it's very, something which you can understand very much, very easily. So in one thing which you have to understand, so first of all, there is a triangular face. So this is how you make a triangle, and if you join this triangle, okay, I'll try to make it once again. So this is one triangle, other triangle. If you join both of these triangle, you can easily make what? You can easily make a butterfly. Okay, so triangle means one is going to be the triangular face. Okay, first is going to be the triangular face. Second is going to be butterfly. So butterfly shaped vertebra, this you have to understand. And the third important thing, this looks like a eye. So you have got a eye manifestation also, that is called as posterior embryotoxon or posterior embryotoxon. So this is about the Alagille syndrome. So by definition, please remember Alagille syndrome starting from A is A, that means it is autosomal and autosomal dominant genetic disorder that causes multisystemic abnormalities. So what is the mutation? You have to understand that is JAG1 or NOTCH2 mutation. It is a JAG1 or NOTCH2 mutation. Okay, this is extremely important because please understand, NOTCH2 specifically is responsible for regulating the biliary architecture. How to remember? NOTCH2, 2 means bi or di, and bi means bi, that is biliary architecture. So NOTCH2 is responsible for regulation of biliary architecture, and NOTCH2 is also important for, Alagille syndrome is also going to have JAG1 gene mutation as well. Now what does this lead to? See, understand, the biliary architecture is not formed properly. That's why it is going to have some biliary issues like chronic cholestasis, that is responsible for causing the neonatal jaundice. Some cardiac abnormalities are going to occur. Most commonly pulmonary stenosis is going to be occurring. Butterfly vertebra I have already told you. Ophthalmology, that is posterior embryotoxon, I have told you. Facies, triangular facies, that's important. Although deep set ears and small pointed chin, see, small pointed chin, deep setted ears, these are important. Okay, deep set ears is actually important, right? Yeah. So Alagille syndrome, 3 things we have already discussed. 2 more things. Intentionally I was not telling you initially. Can you see these 2 C's which are made? So one, what is these 2 C's? One is going to be cholestasis, another is going to be the cardiac manifestations, and in Alagille syndrome, which is the cardiac manifestation, pulmonary stenosis. So in laboratory diagnosis, of course, you know, the different types of I should say the liver markers are increased, like GGT, like bilirubin, like lipid, the PT, PTT, everything is written increased actually. And okay, you got it? Yeah. So we have to give the supplementation from outside. So ADEK supplementations we are supposed to give from outside. Why? Because you know that there is no absorption of fat. See, the bile is not able to act. Bile is not produced properly. Bile is not able to act. That's why the fats are not going to be there, and there is no absorption of fat-soluble vitamins. So vitamin A, D, E, K are going to get decreased. So how will you manage the case? So in order to treat hyperlipidemia, we are going to give the cholestyramine. We are also going to give antihistaminic for pruritus. Now what is pruritus? So understand that because of increase in the bilirubin, this bilirubin is going to get deposited in the skin and it causes itching. So we give what? We give antihistaminics for this itching. Okay, we give antihistaminics for this itching. And of course, endocarditis prophylaxis you have to give because you know there is pulmonary stenosis and everything, and liver transplant can also be taken care of. So in Alagille syndrome, if somebody asks me what is most important, one is going to be cholestasis, cardiac issues, butterfly, triangle, posterior embryotoxon, JAG1, NOTCH2. These are extremely important. And in the end, of course, the treatment, you have to remember that cholestyramine, antihistaminics and everything we are supposed to give. So this was a small topic but important topic, and at least you should know some things which are important out of these topics. With this, I'll take your leave and thank you so much.